alarming proportions, and it's an epidemic in our country, because it's a lifestyle disease, and Indians are also genetically at higher risk to develop diabetes. And diabetic retinopathy is a very serious disorder which we need to be aware of, and also it is important to make the physicians aware of this dreaded disease, because it's initially in the initial stages it's a very silent process, and there are no symptoms initially in the initial stages of diabetic retinopathy. And it is very important for patients to be screened for diabetic retinopathy at least annually once the diagnosis of diabetes is made. For those patients who have early changes of diabetic retinopathy, they may even need screening more frequently, even 6 monthly or even earlier. If a patient is, let's say, on insulin and is an insulin dependent diabetic, then more frequent screening for diabetic retinopathy is important. So the initial symptoms may be just blurring of vision and mild distortion of vision, but in the advanced cases suddenly the patient may develop floaters because of any bleeding inside the eye from the blood vessels. And so it is very important for raising awareness towards the symptoms, and also raising awareness amongst physicians that they should refer these diabetic patients to ophthalmologists for screening. And especially a dilated exam is very important to pick up this disease at its early stages, because as such there is no cure for diabetic retinopathy, and all the treatments that we have for diabetic retinopathy are basically to limit the complications of diabetes. There is no way to reverse these changes once they occur. Another important thing is that it is important, besides blood sugar, to also control blood pressure, to also look at the lipid profile, and also to look at the renal parameters. And in the renal parameters, apart from blood urea and serum creatinine, in the early stages you must look for microalbuminuria, which is one of the earliest changes which diabetes can cause in the kidneys of a patient. Also, another very useful test is HbA1c, which gives us an idea of the 3 months control of blood sugar. So that is a much more important test than just blood sugar fasting and postprandial, because it gives us an idea about the long-term control of blood sugar in a patient. So once these changes are detected, it is important that when the patient develops significant diabetic changes in the retina, they should be managed by a experienced retina surgeon, and the treatments may include laser treatment. They may include giving anti-VEGF injections, which are very popular nowadays and which can control not only macular edema, but also can it can be used to treat bleeding inside the eye. And so it is very important overall to be aware of these disease changes, and also the treatments which are now available to treat diabetic retinopathy.